Hello everyone, my name is Yasin Al-Ma'touk and I'm studying Master in Engineering Management at King Fahd University of Petroleum and Minerals, and today I'm doing this presentation to review this article, Exploration of Social Sustainability in Healthcare Supply Chain. This article was published by the Journal of Cleaner Production by 4 persons from both universities, Abu Dhabi University and California State University, and it was available online since 21st August 2018. And here it's showing the abstract of the article as well as the keywords of this article. The headline for this review are the following points: journal information, introduction, literature review, theoretical framework, research methodology, analysis and findings, discussion and conclusion, practical implications, and finally limitation and future research direction. This is just a brief introduction about this article. First, social sustainability is concerned with the human side of sustainability. That's why this study explored this issue and identified the motivators, barriers, and enablers of social sustainability in healthcare supply chain with the lens of stakeholder theory, and focus on 4 stakeholder groups, which are first suppliers, second employees, third patients or community, fourth owners or government. In the literature review of this topic, it was found that true sustainability occurs at the intersection of 3 interdependent pillars: economic, environmental, and social. As shown in this picture, the 3 pillars circles are economic, environmental, and social, and in order to achieve total sustainability, more focus on these pillars has to be taken care of. However, these pillars are not giving the same level of attention, and intensive focus only for the both economic and environmental pillars resulted on lack of research in social sustainability part. And social sustainability is usually addresses issues related to quality of life and drive decision makers to consider the potential social consequences of their decisions. And because healing patients is the primary outcome of healthcare supply chains, social sustainability is becoming a key objective within healthcare sector. The theoretical framework shown in this article was to provide positive patient outcome. Healthcare facilities should move beyond the notion of just treating disease toward prevention and wellness, which are major components of social sustainability. And the key to attain that is effective integration of the business functions and channel members, and this can be called stakeholder theory. And it should be noted that more attention toward expectations and opinions of all stakeholders who affect or are affected by the business is critical. Based on the theoretical framework explained in the previous slide, we can summarize the objective of this paper in 3 points. First, to explore the motivators, barriers, and enablers of social sustainability in healthcare supply chains from stakeholder perspective. Second, to identify commonalities of social sustainability perceptions among stakeholder groups, the things that are common between all stakeholders. Third, to develop comprehensive social sustainability framework that integrate the perspective of all stakeholder groups within the context of United Arab Emirates. In the research methodology, the author, in order to facilitate the linkages of different supply chain stakeholders, supplier input process output customer techniques has been used, which is one of the Six Sigma techniques, and the supplier was selected to be healthcare suppliers. Input as a healthcare employees, process main healthcare processes, outputs products and services of healthcare processes, customer as patients and community. Data has been collected from an open-ended survey distributed to top 10 hospitals and healthcare regulatory authorities of United Arab Emirates. And in order to test the proposed framework, the study has adopted a survey-based industry research method to collect empirical data from selected hospitals in UAE. The structure of the survey is developed based on the framework as shown here in this process flow diagram, which shows the four stakeholders categories, which are employee, supplier, owner, and patient. All these stakeholders categories are giving their input in the survey and their view of social sustainability. And in exact, each category is giving what are motivators, barriers, and facilitators or enablers which drive for social sustainability. So these inputs of the participants were initially filtered and shortlisted to generate the main theme at each node of the chain. So these themes help to distinguish between the views of all stakeholders in terms of what is uniquely identified by each stakeholder and what is agreed on by two of them or three of them, or all of the four groups agree on these motivator or barriers and facilitators, which is the thing that has been focused in this article in the analysis part. In the analysis and findings, we can summarize the output of the survey in these slides. So after filtering the output of the survey by making themes and categorizing them based on whatever agreed by all stakeholders, these motivators, barriers, enablers of social sustainability in hospitals are the common agreed by all stakeholder groups. So in motivators, we can find that culture and values, innovation and technology, sustainability, strategy and goals, policies and regulatory compliance were a motivator for social sustainability in healthcare sectors. And on the other side, policies and regulations, cost pressure, resource limitation, high competition, lack of commitment to sustainability, perception towards sustainability were as barriers for social sustainability in healthcare sectors. And lastly, innovation, and technological advancement, open communication and information sharing, organizational culture and strategy, resources efficiency, sustainable supply chain practices, or as enablers or facilitators of social sustainability in hospitals. So this is like a comprehensive stakeholder view of social sustainability. So in order for the health organization to improve their social sustainability part, they need to focus on these motivators and barriers and enablers in order to improve their sustainability and especially social sustainability part. In the discussion and conclusion, we can say that working on one factor would not only have impact on the single factor, but it would also extend to the others. So, for example, providing a certain motivator would lead to overcoming a barrier that would lead to a more socially sustainable behavior. The framework of this study meant to help the hospital prioritize the area that it needs to address. So motivators, obstacles, and facilitators mentioned in previous slide in the figure 6 reflect those the hospital need to emphasize and focus by making major improvements to reach an acceptable level of performance in social sustainability. Is what have been studied in this article is practical or not? We can say that this paper helps healthcare managers make smarter decisions based on their own supply chain. Besides, it would foster a diligent program to engage all the stakeholders in forming better coordination schemes. Although the set of motivators, barriers, and enablers may be different from every healthcare supply chain, a broader understanding of the scope of the area would help them in improving their organization socially, and this will lead to the improve of the total sustainability of the organization. The last topic that I would like to talk about in my presentation is the limitations of this article and what might be future research directions. Though this study highlights indicators of social sustainability from stakeholders' perspective, it has some limitations that could be addressed in future research. For example, one may explore one of the following 3 points. First, the validity of the identified factors, motivators, barriers, and enablers in other surface supply chains. Second, similarities and differences with respect to the identified factors in other neighboring countries. Third, comprehensive set of factors that encompass the environmental and economic aspects in surface supply chain, along with the identified social aspects. In my opinion, social sustainability is very important aspect, and as showing in the literature review, there is a big gap in this field. If the supply chain organizations put more attention to their social sustainability part, it would drive the other 2 aspects economic, and environmental sustainabilities, which would lead for total sustainability, and this will benefit for the improvement of the supply chain sectors. Finally, I hope this presentation enrich your knowledge in this area, and thank you for your listening.